You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxie Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Shani Bocian, who is the co-founder and CEO of Allermi. Welcome to the show, Shani.
Thanks so much.
It is good to have you here today.
It's so good to be here. Thank you, Dr. Roxie.
So let's start off by telling our audience a little bit about your background and why you're doing what you do.
So I was born and raised in the Bay Area in California, which is one of the most allergenic regions in the entire world. And my dad is from the Central Valley of California, which is the most allergenic region in the world. So I've had allergies my whole life, and I'm very lucky because my dad is an allergist. So I grew up running around an allergy clinic, getting shots every week, using nasal sprays, taking allergy medication. And it really was kind of an integral part of my life. The story of Allermi, my company, really starts back actually the year I was born, back in 1992. My dad had just graduated from fellowship. He did his fellowship in allergy immunology at Stanford. And he realized at that time that his patients who had rhinitis, which is the disease of nasal inflammation that can be caused by allergies primarily, but can also be caused by non-allergic conditions, viruses and colds, etc. Everyone's had it. It's super common. A lot of people have it chronically. The symptoms are stuffy nose, runny nose, itch, sneeze, postnasal drip. But my dad realized that his patients with the severe rhinitis, the chronic rhinitis, were not getting better from the medications they were buying at the drugstore. They were taking Benadryl, they were taking Allegra, they were taking Afrin, they were taking Nasacort, and they were still really suffering. A lot of them were filling up baskets of medications at the drugstore every month and trying different cocktails and just not getting better. So my dad realized that if he were to take the best medications for rhinitis, the ones that he would recommend to his patients, and combine them into one single formula, and then adjust the dosages of those medications based on each patient's symptoms and severity, then he could create a formula that would comprehensively relieve all rhinitis symptoms, that would be safe for daily use, and that would just work better than anything on the market. And so that's what he started doing in 1992. He was mixing up formulas and nasal sprays in his lab and giving them to his patients, and his patients were doing incredibly well. And he became really well known for this. His name is Dr. Robert Bocian, and they started calling these formulas Bocian's potions. There's a joke that everyone in the Bay Area has a Bocian's potions in their medicine cabinet. It just became really ubiquitous and well known. And so many, many years later, after a lifetime of using these medications myself, when I started to learn about digital health and telemedicine, and I'd see brands that were making healthcare more accessible to people using the internet, I was like, Dad, there's a huge opportunity here to take what you've created in your lab that you've been giving your patients for 30 years and make it accessible nationwide. And so that's what we did with Allermi.
Wow. I want to buy some. So many different things, and growing up in New Orleans and living in Florida, there's just I'm allergic to my pets. I'm allergic to so many different things, and it's frustrating. I remember not that long ago, I bought a nasal spray, and I kind of really wasn't having a whole lot of symptoms. I was thinking of it as maybe like a preventive thing. So I would just get in the car to go somewhere, and I do like a squirt, and we're off to wherever we're going. And all of a sudden, I just feel horrible. So we went from really feeling like okay to feeling like bad after the nasal spray. I don't know what happened, but I just sneezed for like 15 or 20 minutes after. It was like complete opposite effect of what I was looking for.
If you sneeze after a nasal spray, it's actually a sign potentially that there's a lot of inflammation in the nose, because as you know, inflamed tissue is really sensitive, which is why, like, if we get an injury and there's swelling, when you touch it, it hurts to the touch. So nasal mucosal tissue is really similar. We actually compare it to the gums a lot. It's a really similar type of tissue. It bleeds easily, it swells easily, it can hurt. And when you use a medicated nasal spray on an inflamed nasal tissue, it can overreact and respond with increased sneezing, increased runny nose. And so the solution, actually, it's like a catch-22, but the solution is to keep using the therapeutic nasal spray to get that inflammation down. And then eventually we would, anticipate that the sneeze response would calm. But growing up in Louisiana and Florida, I mean, the allergy seasons there are perennial, which
Yeah,
means year round. I mean, they don't, there's no seasonality, there's no winter freeze, so there are allergens in the air all year.
all year. Yeah, yeah. I remember growing up thinking that I was allergic to the sun because when I would play softball growing up, I would be out in the field waiting for the ball to come, and I was really awful. I was in the right field, so not a lot was going on. And then when I a ball would come my way, I would have my ball like this, and I just like my eyes are just crying and crying and crying, and I'm sneezing and itching, and
Oh
I couldn't
no.
catch the ball.
Oh my
It was
God.
my allergies. It was horrible.
Oh yeah. Yeah, being
Oh,
outdoors in the summer in the South
yeah.
is can be
Yeah,
really tough.
definitely. So I want to, just kind of dig back in. We were talking earlier how when I read the description of your company and it being a revolutionary telehealth company, I was really kind of scratching my head going, okay, it's 2023, 2024. How is telehealth revolutionary? But what I think is so incredible is that it's so super niche. It's a specific kind of use case, if you will, a specific patient population, a very niche business model that's been wrapped around telehealth technology just to be the facilitator of the doctor patient relationship.
Yeah.
It's really great.
Yeah, absolutely. Yeah, we really pride ourselves on our niche focus. I mean, allergy as a whole is such a broad category. You have so many diseases that are covered under the umbrella of allergy. You
Mhm.
have eczema and asthma and immunological disease and food allergy and rhinitis. And for us to pick one and focus on it so intently, we've
Yeah.
been able to go really deep and really create a treatment mechanism and formula and protocol that serve this very large but very niche population really effectively. And I love that. I love depth over breadth.
Hmm. It's the winning way. That's
I
for
think
sure.
so. I think so. I think you could just provide better care. And look, there are incredible businesses and health systems out there that are obviously extremely cover wide ranges of disease areas. But for us, we're a small company, and I just think we can offer better care by really honing our focus.
Well, I think it's the way to go. I mean, if you think about it, Jeff Bezos, everything that I've read about the early stages of the company, it was a book company.
Yes,
Would have never known and envisioned what he would be, what his business model and flywheel would look like today. But
absolutely.
started somewhere and really penetrated that market and then expanded once he could. So who knows what you might look like as an organization in 3 to 5 years.
Oh, absolutely. I love the Amazon comparison. I have such good memories of my mom, the first days of Amazon, ordering books online. And I love that comparison.
Too.
That's great.
Yeah,
Yeah.
yeah. So let's talk about like how long the company's been in business. When did you launch? And what has that, launch and growth journey been like?
Yeah, so we came together as a group in right after COVID started. We incorporated and started, planning to launch Allermi, and a lot of what was involved in that was building out our formulary and building a base formula for our nasal sprays that was soothing and therapeutic and didn't create a lot of side effects, that wasn't over drying, that didn't burn. So we
Mhm.
spent about a year working with a chemist to develop our nasal spray. It was based off of 30 years of my dad's work in terms of the active ingredients, but now we were finally building our own base formula from scratch. And so that was a lot of the work that we did in that initial year, was testing over and over and over again to ensure we had the best possible product. And then we built our technology stack. We figured out how we were going to market. We did a lot of beta testing with beta users in the early days. We contracted with our compounding pharmacies, had our saline manufactured, and then finally we launched in September of 2022. So we've been on the market for
Mhm.
just about 15 months. This is our 16th month on the market,
Yep.
and we've been growing really quickly. People are really in need of relief.
Yes. So, was there ever a consideration or debate within this journey of whether you were going to go B2B or B2C, or did you always know that you were going to go direct to consumer?
We always knew that we wanted to start out as a direct to consumer company. Um, One of the big issues in allergy is access to good care. So there are a couple thousand allergists in this country. The ratio of people to allergists is about 1 to 100,000.
Yeah.
So there's a shortage, and most of the allergists in this country are concentrated on the coastal regions in large urban areas. And so you have a tremendous
Mhm.
population of people who are suffering who don't have access to high quality allergy relief or high quality allergy care. So what they end up doing is going to the drugstore, self-selecting medications, self-treating, using cocktails of drugs that are not necessarily optimal for them, and not getting better. And so being able to target consumers directly was, we felt, and still feel like that solves that problem.
Mhm.
Going through health insurance carriers or physicians or health systems or employers felt like a really kind of burdensome and indirect way to target our core customer, which is the allergy sufferer. And so targeting them directly has been highly effective. And we've been able to build up a really large customer base just with 1 year on the market, with direct to consumer marketing. With that said, Allermi is a very compelling medical therapeutic. It's novel and it's highly effective and it's very strongly evidence based. And so the interest from physicians in partnering with us has been strong. And
Mhm.
so while we didn't ever really anticipate being a B2B or B2B2B, B2B2C, like business to business to consumer
Yeah.
company, we do think that there's an opportunity there to work directly with physicians and health systems.
Yeah, as I worked with health tech companies and that are looking to go direct to consumer, one of the things that we're always working through is, you know, how are you going to find that group, right? Like,
Mm-hmm.
where are they? And often in healthcare, there's some situational triggers that qualify a specific population. And so having a list of people isn't always going to tell you exactly who's needing your solution right now at that moment in time. So with that in mind, what are some of the marketing or advertising strategies that you guys have used that have been successful, and maybe some things that you've tried that haven't been so successful?
We've done a lot of testing with our marketing to consumers and really trying to figure out what resonates with people and then what also attracts the type of customer that actually really needs and really benefits from and will stay with Allermi. What we found works really well is utilizing our physicians. We have two expert renowned Harvard and Stanford allergists who are our founders, and then we have 12 physicians who work with us who are just exceptional in their field. And so
Mhm.
utilizing them to spread information and education and create content for us, and then using that as a mechanism of converting patients to purchase has been highly effective. And then
Mhm.
another thing that's worked really well is just social proof. Like we have, we've treated tens of thousands of patients. We have thousands of reviews on our website. We have hundreds of video testimonials from patients who can really talk in detail about how Allermi has changed their life for the better, and utilizing that content and sharing that with the on our social channels and in our paid advertising has been super effective. And then of course there are ads that have been less effective that we test and then we take them down quickly if they're ineffective, and we always are trying to pivot and test new things and really try and figure out what's resonating.
I have to be honest. I've my background is in marketing. So I've been helping
Hmm.
healthcare companies for almost 20 years or over 20 years with marketing strategies and advertising and so forth, and go to market stuff. And one of the reasons why I got so excited about being in healthcare 20 years ago is because it was so antiquated, right? All of the marketing and advertising strategies that other verticals were applying. I mean, healthcare was like 10 years behind. And
Yeah.
when I looked at your website, I almost thought to myself, this doesn't even look like a healthcare company because
Mm.
it's so effective.
Yeah.
It's filled with all of the best practices on messaging, on UI UX of the website, on
Oh,
clarity, on the social proof, being optimized for sales conversion on the site. I mean, just so many different things. So I was like,
wow.
wow, this is impressive.
Thank you. That's really kind of you to say all that. And we have an incredible marketing team that is credited with that. But, you made me think of something, which is that, I think about like allergy medicine commercials, which is
Mhm.
the main way of the advertising for allergy products,
Yep.
magazine, TV. Um, and it's always like a woman running in a field, and it's so high production and so commercialized, and in a
Yep.
second when you're about to get an Allegra ad, because you see it starts at the feed and then it goes up, it's just the
Right.
same. And you don't you can't big pharma, the way that they advertise is the restrictions are really different, from the way that we can
Hmm.
advertise on social. And to be able to have the physicians who invented this product and who are the experts in this, the leading experts in rhinitis, be able to go and you see an ad with that doctor in his study at home in his lab coat talking about the product. Like, that's, to me at least, just it's the modern age of advertising. It's so much more relatable and organic and compelling than seeing this high production like stock video of a woman running in a field smelling daisies.
Yes, exactly. I completely agree with you. So, who came up with the name? Because I absolutely love it. Again, that's one of those another things that I think, you know, innovators tend to come up with names that mean something to them and don't mean anything to the target audience, or don't have really any like purpose behind it, or it's some kind of meaning, but you've got to pull back 20 layers to actually really understand why they should care. And Allermi, being personalized allergy medicine or personalized allergy experiences, I mean, it's brilliant. Who came up with that?
Oh, thank you. I can't remember who came up with that. It actually, Allermi was a placeholder name. We were like, we'll just call it Allermi for now, and then we'll think of something better. And then it just stuck.
Oh.
And I remember sitting at a cafe with my two co-founders, and
Hmm.
we were like, should we just call it Allermi? Like, we've been calling it this whole time. The last 3 months we've been working together, we've just been calling this thing Allermi. Maybe let's just keep it. There was a period of time when I
Hmm.
wanted to call the company Aviv or Aviv,
Uh-huh.
Aviv, which means spring in Hebrew. And I thought that was a cool name. But then at the end of the day, like, most people wouldn't know the correlation,
Exactly.
and wouldn't know what that meant. And
Spell
so,
it, and remembering how to spell it,
yes, exactly. Yeah, totally. So
Yeah.
we stuck with the Allermy. I feel like it was my chief medical officer's idea. I feel like she came up
Mhm.
with that. We were like, let's use it as a placeholder, and then it just stuck.
Yeah, that's great. So what are some of the things that you've done over the last 15, 16 months in the growth journey, some of the challenges that you've encountered and how you've overcome them?
That's a great question. Um, I think there's so many mechanisms of conversion. There's creative, like what the actual ad looks like and says. There's the offer, how do we convert people? How do we compel people to try this, something they've never tried before? Um, there's the price.
Hmm.
And so all of those components require just a ton of constant testing to be able to figure out what's most optimal. We've done a ton of testing on the creative side, but the offer and the pricing, we did, a small test when we launched, when we had just a couple dozen patients, but we haven't really ventured into testing at larger scale on offer and pricing. And so I think that's one of the challenges that we have now is, okay, we've been in the market for 15 months. All of our ads and the comments on social media and our FAQ and our website and everything talk about our current offer, which is a first month free trial. So, subsequent months are $35 plus shipping. Now we have a big customer base. We want to test other offers. Like, how are we going to do that after we've been, utilizing the same offer
Yeah.
and pricing for the last 15 months? So that's one challenge we're kind of trying to figure out now, is how do we really dive back into testing. And Yeah, and then, this free trial that we offer, we kind of stole the idea from big pharma, which is, give doctors samples of products to give their patients, and if the patients like it, they'll continue with the prescription, or they'll get a refill.
Yeah.
And that model's obviously worked quite well, and it's been amazing for us. It's been an incredible push on the gas pedal for our growth to offer free trial, but obviously it's expensive because we are covering the costs of all of these prescriptions for first month users for free, and so
And
that's again.
cost associated with direct consumer, because that's one of the things that I hear often is,
Mhm.
oh no, we need to go B2B because it's too expensive to go direct consumer.
People say that. I don't think I actually agree with that because going B2B, the sales cycles in B2B sales are 100,000 times as long. You can convert someone in a few minutes direct to consumer. It can take a year to close a B2B contract. So
Right.
there's a funny saying people say, they say B2B for show, D2C for dough. I really think I'm so
We
bullish on.
blend there.
Yeah, I really am very passionate about direct to consumer health. I think when
Yeah.
once you go B2B, you're no longer democratizing that access. And all of those people that we talked about who don't have access to insurance, who don't have access to allergists, who aren't going to top, health systems, who don't work at employers that we would partner with, like they would be missing out on the opportunity to get treatment from us. And so I still really believe in direct to consumer health despite all the challenges.
I completely agree with you. I think both have pros and cons. And of course, I think it depends on the offer and the business and so
Yes,
forth.
of course.
But yeah, I completely agree with you. And you think about the customer acquisition cost for a hyper targeted ad through on social media. I mean, you could iterate and test that so much before
Mhm.
you ever even came close to the cost associated with, traditional salespeople knocking on
On
doctors'
doors.
doors.
Absolutely. Absolutely. Yeah, it's way more capital intensive to do sales on a B2B level, but it's certainly something we're talking about because at the end of the day, a lot of people are seeing allergists and ENTs, and
Mhm.
what their doctors are saying is go back to the drugstore, here's a shopping list. And they're buying the same things that people who don't see a doctor are buying, maybe with a little bit more of tailored recommendations, but
Yeah.
it's still the same product. And so to be able to offer our product with via allergists and ENTs as a conduit, I think will eventually be a strategy that will be really beneficial.
Yeah. So let's talk about the funding journey for you. As we're talking about the cost associated with direct consumer, the cost associated with the offer structured with a free trial.
Mm-hmm.
What has that funding journey been like for you?
Yeah, we've raised 2 rounds of venture capital. We raised a pre-seed and a seed round. Our most recent round was our seed, and that was led by an incredible investor, and that was about a $3.5 million round.
So, what are some of the questions or kind of those kind of conversations around what they're looking for a company your stage that's direct consumer with something so niche?
You know, at the time that we raised our seed, we were very, very early. We were doing our annualized revenue was like $200,000. So our monthly revenue was in the 5 digits, and we were very young and very early. And so at that time, it was really about the story, the background, why we started this, where we think this can go. And now fundraising, when you're a company that has annualized revenue in the millions of dollars, it's all about the metrics, and it's all about the gross margin and the unit economics. And is this company on a path to profitability that's clear within the next 12 to 24 months, and how capital intensive are certain projects that they have planned for the next 2 years. And so it's a really different type of fundraising once you're a revenue earning company that's been on the market for over a year. But for anyone who's doing seed funding, the story around defensibility and uniqueness and the moat, I think, is incredibly important. Is what differentiates this, and then also why is the team the best team to do this. I love that question, and I think that's something that investors really focus on early on, is why you and how you, and that's what's going to kind of make or break a business. I think, as a founder, investors were looking for coachability, leadership, uh, um, flexibility and ability to pivot, um, capital, frugality, uh, and
Mhm.
then just kind of strong finance skills, being able to build and explain a financial model. I think all of that was like really imperative when raising those early rounds.
So, how has this endeavor shaped you on a personal level and maybe even on a professional level as an entrepreneur, as a younger entrepreneur?
Yeah, I think I've built up a level of grit and tenacity and persistence that I don't think I ever had before. My career prior to starting Allermi was in the education space. I was a teacher, I was a researcher, and it was always just a struggle. I never felt passionate about what I was doing, and I didn't wake up in the morning excited to sit down and get to work. It was always just like, oh, what a drag. Probably because I wasn't good at it. I wasn't good at teaching. I wasn't great at research. It wasn't the right career for me. But, with Allermi, our number one priority that's miles ahead of everything else is patient care. And to be able to wake up every day and open the message boards and see messages from our patients and ensure that they're being cared for in the most caring and compassionate
Mhm.
and evidence-based medicine kind of nature, um, has been such a fire under my seat. It's just that's what keeps us going. And like when I just like working for 16, 17 hours a day sometimes, and it's like, why? And it's like, oh yeah, because there's a patient in Oklahoma whose nasal passages have been blocked since 1989, and they've never breathed through their nose, and now they can, and they have a new lease on life. And like that's what
Yeah, yeah,
so
absolutely. I mean, because you're not innovating something in any other vertical where but it really doesn't matter. You're innovating something in healthcare where people's real people's lives are at stake, families are at stake, because it can be debilitating. And yeah, I mean, there's so many different things that can happen, both positive and negative, and it's really quality of life, where it matters, it makes a difference.
absolutely.
So, is there anything else that, as we kind of wrap up here, is there anything else that you would want to share with our audience?
No, I mean, if I imagine a lot of people listening are innovators in healthcare, and probably a lot of founders. And I think it's if you're passionate about what you're building, and you believe that you're providing a solution to the world that is needed, just keep at it. And they're going to always be naysayers.
Yeah.
I remember when we were starting Allermi, there were people who were like, go be a teacher. Like, we don't need more entrepreneurs. We need more teachers. And I always tell that story because I literally, like, it was an older, very successful investor who told me that. And,
Oh,
and I was like, okay, I guess I will. I took that, and I was young. And, now if I go back and I'm like, oh, I should have, why did I listen to that guy? It was like, I was so naive. I was 24, and I shared the Allermi idea with him. And then I ended up just dropping it and teaching for a couple years and thinking
oh
about
my
Allermi
goodness,
every day.
wow.
And it finally got to the point where my parents were like, okay, you need to start this thing. Like, it's time to quit your job and teach. You've been talking about this way too much. Um,
I was going to
uh,
ask you that, like, what was that conversation like with your dad when you came to him with this idea? Was he supportive, or was he like, oh yeah, right, like, I don't know about that, or like, yes,
yeah.
go full force?
He's a physician and a scientist. He's not a businessman, and he's not an entrepreneur. And so kind of wrapping the idea around taking what had been so limited within the walls of his clinic, and then like the idea of turning it into a big business, that was kind of a discussion that took a long time about
Mhm.
strategizing how that would work and whether that was the right thing to do. And why hadn't it been done before? And would someone copy it? And would Amazon there's a lot of kind of concern and doubt about whether this was viable. And so, and then, as I mentioned, like there are the people who said things to me like, if this was a good idea, it would have been done before. And, as I mentioned, like we don't need more entrepreneurs. Go be a teacher, you have a degree in education. And so kind of jumping over those hurdles in the very, very early days and getting over those fears and doubts and concerns, I'd say that was probably one of the hardest parts. Now it's hard because we're working so much. There's so many hours involved, but that was really emotionally and mentally the hardest part of this journey, is getting to the point where we're like, we're actually going to do this, and like we're going to succeed, and it's going to work, and the world needs this.
Every revolutionary innovation faces that, right?
I think it must. I really think it must. But that's where you grow the most.
Yeah, yeah, and no one was doing it until you do it.
Right. Exactly. Right. I know, stupid thing to say, but
Oh my goodness.
people
Wow.
will say a lot of things, I think, especially to female founders. Like it's a different world. If there are any women in healthcare listening, like it is. I know we're in 2023 and things are modern and better than they've ever, but it's a different world out there if you're a woman and you're in this field.
I led a workshop not that long ago, or speaking engagement and I titled it, Do Women Founders Need to Present Like Men to Get Access?
Mm,
And it was a very interesting discussion.
what did you find?
Well, the evidence does show that there's a huge disparity between access to capital with female founders versus male founders. Only about 2 or 3% of capital goes to female founders.
Mm,
If they partner with a male co-founder, it actually jumps from like 2 or 3% to 14%,
wow.
which just kills me.
It's so funny. I just realized last night I had a meeting with an investor recently, and we'd been talking for about a month. Um, and when we met in person, I reached out to shake my hand, and he reached out to give me a hug. And then when he said goodbye again, he gave me another hug. And I at both times I reached out to shake my hand because it was a
Yeah,
professional interaction. We're not
yeah,
friends.
right.
And I was thinking, I wonder if a male founder walked in, if they would have given, and they'd had the same number of interactions, the same number of like meetings prior to meeting in person,
Right.
would
Yeah.
he have given him a hug? And the answer is
Mm-mm.
almost for sure no, absolutely
Right.
not. And I'm like, why
I
did
agree.
that happen?
Yeah. Yeah.
It's really bugging me.
Well, one of the key findings was, the questions that are posed to women founders are different than the questions
Mm-hmm.
that are posed, and often how women respond to those questions sets them up for not getting access to capital.
Wow.
So, that the evidence is, if a female founder is asked a question that might kind of teeter on something that's kind of challenging within the company, typically a male founder would just sell all of the positive, where a
Mm.
male founder would often be more transparent about some of the challenges. And so you can just see line after line. And so there's really a science behind answering those questions in the pitch room,
Wow.
to be able to increase access to capital and
Wow.
have more, female led business
Mm.
dreams come to fruition.
That is fascinating. I'm curious if there's a correlation between female founded businesses and
So I don't know if there's been any specific studies or research reports around female founded companies, or especially like in healthcare, but I can tell you there's a lot of evidence out there to show that there's a skill set and ability that females have that often complement and bring something unique and different than male executives. And
hmm.
so when you've got more diversity in the C-suite, you tend to have higher performing outcomes. And then certainly there's a lot of evidence these days around, adding females to the board and creating more diversity there, and how that's positively impacting the performance of those organizations.
Hmm. Fascinating. I'm not surprised.
So how can folks get a hold of you if they want to follow up with you after the show?
Yeah, feel free to send me an email, Shani, Shani, at allermi.com. I'm on LinkedIn under Shani Bocian Steinberg, which is my married name. And if anyone wants to reach out, healthcare founders, women founders, I'd always happy to chat.
And if anybody wants some Bocian potion, go to allermi.com.
I love that. Yes, absolutely. If anyone has rhinitis, allergies, nasal congestion, that's exactly what we do.
Yeah. Well, thanks for joining me today.
Thanks so much, Dr. Roxie.
For anybody that's listened, if you haven't subscribed, please do so now, and feel free to share this episode with any of your colleagues or people in your network that think they might benefit from what Shani shared with us today. Thank you. Thank you so much for listening. See you on the next episode of Health Innovators.